About it. People talk about obesity, overweight. 60% of the nation now overweight adults. It's affecting our children as well. And certainly gastric bypass surgery, one of the most extreme, one of the most invasive, one of the most possibly dangerous ways to try and combat obesity. But certainly celebrities, politicians, athletes, they're all choosing, even teens are choosing to have it done.
So we need to get this out.
Singer Carney Wilson, weatherman Al Roker, actor Michael Janadri,
my ability to,
and Congressman Jerry Nadler all underwent gastric bypass surgery because they were morbidly obese. They call it morbid obesity when your body mass index is greater than 40. This number is derived by comparing height to weight. For example, a 6-foot-tall man would be considered morbidly obese at 300 pounds, more than 100 pounds overweight. This scale does not apply to very muscular people such as bodybuilders because much of their weight comes from muscle. The morbidly obese often die young, of heart disease, diabetes, and a variety of other health problems. When attempts at dieting and exercise fail, a patient may qualify for gastric bypass surgery. The most common procedure is called the Roux-en-Y procedure, in which the stomach is divided into two parts. The upper part is about the size of an egg. A section of intestine is attached to this pouch and the other end to the intestinal tract. Food now enters the pouch, which fills up more quickly and bypasses the rest of the stomach. In addition to getting full quicker, eating lots of sugar and fat will make the patient feel sick.
All right, and there are a lot of other side effects as well when we're talking about gastric bypass surgery. Some of the side effects that people are concerned about, the nutritional problems afterwards, liver problems, sugar intolerance, and also excess skin can be a real problem as well when it comes to having had the procedure done and the time afterwards. We want to hear from you on this topic. There's a lot of interest in this topic, and there's a phone number for you to call, 800-807-2620. You can also email us at cnn.com/health. And to help answer these questions, we've got a couple of guests who you're going to want to meet. First of all, let me introduce you to Dr. J.K. Champion, who joins us right here in Atlanta. Dr. Champion's done about 400 or so of these procedures a year. You do these procedures, a nationally recognized expert on this particular topic. We also have joining us from New York, Michael Janadri. You're going to recognize Michael. Michael Janadri is a star of one of television's most popular programs, Ed. He had the procedure done about 4 months ago and has already lost 115 pounds. Michael, thank you very much for joining us as well.
You look great, Michael.
Thank you for having me, Sanjay.
Thank you. Dr. Champion, let me just start with you really quickly. You've done a lot of these procedures. Who is your typical patient, and who qualifies to have this done?
Okay. We strictly follow National Institute of Health guidelines, so patients must be at least 100 pounds overweight or have what we call a body index of at least 40 or have some significant health problem associated with it. This really is a serious operation, and it should be reserved as a last resort. Our average patient's about 38 years old, about 315 pounds with a body index of 51.
Wow. And again, you do about 400 of these a year. How many have you done total?
1,300 in the past 8 years.
Wow. Okay. Why don't we go ahead and get to our first one right away? It's actually an email question, and I'm going to address this to you, Dr. Champion. It's about after the operation, and specifically asking here, how long would you wait after gastric bypass surgery to remove excess skin? This is I'm sorry, there's another question here. What happens when all the weight is lost? You are still limited on food intake. What about nutritional deficiencies? A significant question there.
That's something that needs to be monitored lifetime, and we recommend patients take vitamin and mineral supplements and come in yearly for exams. The surgery is designed to stop working at about 18 months because we start out with a pouch very small, about the size of your thumb, and it stretches up to about the size of a lemon. And then the area of GI tract that we're bypassing first doesn't absorb calories, and then after a period of time begins to absorb calories again. So the surgery is designed to sort of stop at 18 months. And so, but you do have to continue to monitor for nutritional deficiency.
So, and you're telling these folks to take vitamins and other supplements during that time?
Yes.
They're not absorbing as much. Okay.
Right.
Lot of interest. We got a phone call question actually coming in. I believe this is Sherry from Arizona. Question about average weight loss. Go ahead, Sherry.
What is the average weight loss that's lost during that period of the 18 months, and is there any weight gain that is gained back?
Typically, patients wind up losing somewhere between 60 and 80% of their excess weight over the 18 months. About half of that will be the first 6 months, and then about another 20%, and then about another 10%. But so it does take the entire 18 months to lose the weight. And there can be some weight gain. Typically, people bottom out around 18 months, and then put back on about 10 to 15 pounds as they get a little looser with their habits and don't exercise quite as much the second and third years.
Real question, is this operation covered by insurance?
About half the time, and that's a major roadblock right now to patient access is the issue of insurance coverage.
Who's covered and who's not?
It depends on the policy. Typically, Aetna, Cigna, Blue Cross, United Healthcare will cover it under certain circumstances, but it depends on the policy.
Okay. I got another phone call question coming in. I believe Harry is calling in and has got a question about diabetics and gastric bypass. Go ahead, sir.
Yeah, I'm type 2 diabetic, and I also got CAD and COPD, and I was wondering how safe it would be for someone like me.
Coronary artery disease, chronic obstructive pulmonary disease, diabetes. People have health risks when they're obese. Does that make it harder for you to perform surgery?
No, it doesn't make the surgery harder. There is some slight increased risk, but there was a recent article that was done at East Carolina University looking at surgery in the diabetics, and they felt that every diabetic, adult onset, that is overweight should have gastric bypass because there's a 90% cure rate.
Wow.
90% of the diabetics in our practice that have this surgery leave the hospital 2 days later off insulin and all medications permanently.
Wow, that is remarkable. A rousing endorsement, no question, for that sort of surgery. But there are a lot of risks as well. We're going to talk more about those.